Guys, Dr. Corey here, and we are going to go over metabolic testing today. All right, this is one of the many tools that we use in our core clinics in order to help identify and measure each individual's unique metabolism. So when you look at this is what this device is, a space-age looking device. You simply, put the mask over the patient. They sit in a chair, they breathe nice and relaxed, and this helps measure the amount of fat or glucose, right, that they're using as energy. From there, it allows us to get a lot more specific with the amount of intake needed, what types of foods to bring in, and all of that based on the person. The reason this type of test is important, all right, is we know that for a weight management system to be as successful as we get results it has to be unique and customized to the individual, period, all right? So it has to be personalized. And a good example is with metabolic testing. Like if we were to do just basic our RMRs or basal metabolic rates on the internet based on equations, age, sex, weight, those things like that, they can differ between 200 and 500 calories daily. All right, so if you do the math on that, that's up to 20 pounds a year. That's up, some even almost 50. Okay, depending on which metric we use, and that's a significant amount. So a lot of people are paying online stuff to do macros and all that, but they're not even testing. And the issue with that is you're just not going to get the success you deserve. So we have to test, all right? I always say don't guess, assess. So making sure that we're getting your metabolism based on your biochemistry so that we can deliver the best results possible, okay? This is also really important for our alumni. Alumni, as we get closer to the physique that you deserve, there's not as much fat left on our alumni. At that point, we have to make sure they're eating enough. This is where this comes into place, all right? This will actually learn your metabolism, let you know, it'll rank your metabolism, it'll let you know kind of where it's at compared to people your age, and it'll allow us to get very specific caloric intake data so that we can design a macro system around that for alumni. Okay, this also, we've seen a lot of popularity with this as of recent because it helps you understand lung capacity, right? It actually gives a measurement of lung capacity. Well, that's been great for a lot of our quote unquote COVID long haulers that are wondering, where are my lungs? Was there any damage? Where am I at? This device is helping to give us some more analytics on that. So if you haven't gotten your metabolic test, schedule that. I would recommend doing this test, at first, probably every 90 days, 6 months. And then from there, check in once a year, once every couple years, depending on, what your goals are, and just make sure that you're designing your nutritional program along with your output. Okay, it's really important. Those two have to go together if you guys want to get results. Otherwise, you may try a lot of different stuff and give up on it too soon. Okay, so schedule your metabolic test. It's about a 20-minute test. We get, 8 pages of information. It's really good, including macros, including calories. All those things are coming off this test. So get it scheduled as soon as possible and keep moving on your weight loss journey. All right, take care.